those who don't have the digital skills, it widens the gap even further. So digital social protection therefore refers to SIMs, social protection SIMs that are accessed by digital means, so either through your smartphone, a computer, smart cards, or any digital device. And the introduction of this digitalization introduces digital rights considerations such as exclusion, privacy, data security, and so on.
countries from 4 continents. That is Eastern Europe, Asia, Africa, and the Americas. That is South America and the Caribbean. Thank you.
Thank you, Mr. Conde. As you can see, we have a diverse representation on the panel today, and they will be sharing, bringing their experiences on how digitalization of social protection impacts their lives and the research findings that they carried out to shed more light on the challenges they face and the very necessary solutions. So I'll start off with the same question to all the panelists. We'll be starting with Dr. Adebayo. You mentioned um, the number of the population of disabled people being more than 80 countries. We know that globally, 16% of world population is disabled. What is the current landscape of social protection for workers with disabilities? What are the main forms of digital social protection, access, and what are the benefits?
Thank you very much. With regards to social protection, workers with disability, like every other worker in Nigeria, are entitled to both contributory and non-contributory forms of social protection. Within the contributory social protection, they also participate in the pension schemes, health insurance schemes, and of course, within the non-contributory programs, um, we have a number of social assistance that the government of Nigeria, both federal and subnational level, provides for the citizens in forms of cash transfer. And of course, in terms of people with disabilities, it also goes into things like providing assistive technologies like computers, phones, and things like, and other digital gadgets that people with disabilities use, basically. So within the workforce, whether be it in the public sector or in the private sector, people with disabilities are employed, even though the employment rate is very low for persons with disabilities. But when they are employed, they are entitled to all these contributory and non-contributory schemes. But the concerns for persons with disabilities, workers with disabilities, specifically when it comes to accessing social protection, is the digitalization of it, which ought to bring comfort and convenience for workers with disabilities, but which we have found out brings quite a number of challenges due to the non-accessibility, non-availability, and non-affordability of these the digital tools, platforms, and processes adopted in the enrollment for and distribution benefit from social protection programs in the country. For example, when you talk of health insurance schemes, which are of course are mostly done via the internet, a lot of the websites used by health service providers in Nigeria do not conform with the W3C guidelines, which provide guidelines on how websites are supposed to be accessed or accessible to persons with disabilities. So workers with disabilities are not able to effectively use these health insurance schemes, and even though their deductions are made directly from their salaries, so they are forced to pay for services they are not able to access because of the digitalization of the process. The same thing with pension schemes. A lot of workers with disabilities, especially in the public service, are not able to participate effectively or freely or independently in the pension programs of government, because pension fund administrators use websites that are not accessible. Other workers with disabilities, especially those in the informal sectors, uh, find it difficult to use banking services when they are to collect benefits, especially cash transfers from government through automated teller machines, which are mostly not accessible to all forms of disabilities, whether the blind, those with physical disabilities, and those with albinism, and so on. So this is the case for persons, workers with disabilities in Nigeria. The digitalization of social protection has brought with it a lot of digital barriers, which we need to start thinking of how to break down. Thank you.
Thank you, Dr. Adebayo. So I have the same question for you, Mr. Fondi. What's the current landscape? What forms of digital social protection is available for street workers, street vendors, and what are the key challenges that are encountered?
Thank you very much once again. From the research that we've done across Africa, because the picture that I'm giving you this afternoon or this morning, it's a reflection of the trends which is across Africa. The street vendors and the market vendors, they don't receive, or they have not been receiving much attention from our governments, across Africa, in the sense that everything that they would want to be, associated with, regarding social protection, it has to be contributed. In the process, if I'm not contributing anything to that contributory scheme, then I'm nothing. It can be for health, like what is happening in Zambia. Of course, there is this, there is this scheme, health scheme. It's a minimum. The contribution is very minimum, but not everyone can manage to contribute. So as long as you are not contributing, we don't receive any social protection. Yeah, thank you.
Thank you, Mr. Fondi. So we're seeing that even though we have some similar challenges when it comes to accessibility, there are differences in the experience between workers with disabilities and the informal sectors, whereas workers with disabilities might be in formal employment or informal employment, can make contributions. Those in the informal economy often can't even make the minimum contributions they have to access contributory schemes. So we'll come back around to hear about some of the recommendations and solutions that we have. So Catherine, the same. So what is the experience in Zambia? What's the experience from your research, from your being in leading being an affiliate of the International Domestic Workers Federation? What are the digital social protection systems that are in place? What are the key challenges that are encountered? And we also want to hear some of the benefits, because I think we're speaking a lot of the challenges, but it's also good to paint a picture of if this worked properly, what would the benefits be as well?
Thank you so much. For Zambia, we have about 4, can you hear me? Okay. We have schemes that domestic workers can affiliate to. We have the National Pension Scheme. I will ask Emmy to help me with this. They're not enough, but just for people to have an idea of what the National Pension Scheme looks like in Zambia. And we have the National Health Scheme. It is available for everybody, both in the formal and the informal area. And we also have Workers' Compensation Fund. So I will just explain a little bit about the 3 schemes that I'm going to speak about. National Pension Scheme, it requires both the employer and the employee to make contributions. So it's 50% from the employer, 50% from the employee. But it's proven to be a challenge because most domestic workers get low wages, so it's difficult for them to contribute to the scheme. Some employers do not want, they play ignorant to knowing about the scheme, and so it becomes difficult. But for the people that contribute, for some it's a motivation because they know that at the end of their employment, they will have something to rely on, and they will have a form of compensation at the end of the employment. For the National Health Scheme, you have to make a contribution. I'm not sure how much. I think it's about $12. I'm not sure of today's rate, but is it $12? Between $10 and $12, you pay monthly as an individual to for the health scheme. For some employees, for some domestic workers, their employers pay on their behalf, but for some, they have to take it upon themselves to make the contribution. So you're given a card and or a number. When you're unwell or you're faced with any health issues, you just go to any health facility or hospital, give them your identity card, and they'll be able to give you any service that you need without paying. For Workers' Compensation Fund, it comes through when you are involved in an injury, accident. They compensate you. For instance, if you were to injure yourself, break a leg, they come through for you. So for domestic workers, if you look at the National Pension Scheme, it's clear that they support domestic workers. But for the other schemes, it's not clear because they support everybody, but it's not visible. So it makes it difficult. And for National Health Scheme, it is digitalized. National Health Scheme is also digitalized, so you can do it from the comfort of your home. You don't even need internet for the health scheme. For NAPSA, you can either do it virtually, you can visit their office, and you can also visit their website. Thank you so much.
Thank you, Catherine. I also wanted to follow up. You mentioned that there are two schemes. There's one scheme that everyone, the pension scheme, but you mentioned low visibility for the other two schemes, and I think that is a challenge that marginalized workers face in the fact that there is a lack of awareness of the social protection schemes or initiatives that are available to them. So in addition to this, what other challenges do domestic workers face in accessing digital social protection?
Most domestic workers, let me just say average, they work in isolation. They do not have access to TVs, radio, phones. They do not have information. So whatever they know is what they are stuck with. So some people do not know that we have these social protection and we have digital social protection, or they don't even know their rights that protect their work. So it's also part of the challenges that domestic workers face. And also, I spoke about the wages. If you get paid $80, you have 4 kids that are going to school, and somebody comes to you and says, oh, you have to pay $5 for something that they don't know. It is difficult for them to contribute. And also there's a lot of fraud and scam. Currently in Zambia, we have what we call CDF. People get numbers, the call. I think, how many people are here from Zambia? Do we have anyone apart from Precious? Okay, so people call individuals. I think every Zambian has received that call before and say from a stranger saying, CDF money is out, you have to pay 300 kwacha or 1,000 kwacha for you to access it. People that are ignorant will send money because everybody is desperate to receive money. And if somebody is telling you you're going to send me $100, I will send you $1,000. Everybody will be, if someone is desperate, they will make that payment and that number will go off. So a lot of people are being scammed. Someone will call saying, no, we are from the National Pension Scheme. send us your NRC and pay in this mobile money, pay 500 kwacha, and you can come to our office on Monday and claim your NAPSA contribution. You pay that money and people disappear. So we have quite a number of risks that make people not to contribute to these schemes. Thank you.
Thank you, Catherine. Um, Seeing the common theme of lack of access, because when you talk about rights, you have the rights to access to information, availability of the services, digital skills, also the literacy to be able to use those systems. Um, so we see that common thread, and I want to come back to Dr. Adebayo and to everyone. In fact, you've raised valid challenges or highlighted valid challenges and explained some of the barriers that exist or remain in access to digital social protection. So how can we effectively address these needs? So we're in a room with digital rights advocates, we're in a room with different stakeholders, so it would be great to hear from you what can be done by digital rights advocates, people in the room, other stakeholders, because they also collaborate with other stakeholders in the field. How can we address the barriers that remain in access to digital social protection?
Okay, usually we will classify these barriers into three: the attitudinal, the institutional, and the environmental. Under environmental, we have the physical and digital barriers. So beginning with the institutional barriers, we observe that the policies that drive the digitalization of social protection in Nigeria are not disability sensitive. And so if we are excluded policy-wise, if the policy is not sensitive to disability concerns, as far as digital rights and inclusion is concerned, then there won't be provisions when the digital infrastructure are being designed and mobilized to support social protection. For example, a lot of the social investment programs, social protection programs, cash transfers, and like I said earlier, the pension schemes, the health insurance scheme are all driven digitally, and they use websites, they use apps that I, as a blind person, cannot access easily without the support of a third party. And so the policy is important for us to review. Then secondly, the governance of the policy itself. The fact that the policy is not disability sensitive, if the governance itself was disability inclusive, it probably would have reduced the barrier, the effectiveness of the barrier. What I mean here is that we don't have people with disabilities in the management of the digital process of social protection. And so there's no voice for us on the table, on the decision-making table. And so the governance is important to make the governance disability inclusive. The attitude and the capacity of the individuals involved in the delivery of digital social protection is also very important. We found that a lot of the policymakers themselves have very poor and negative perception of disability. They don't perceive disability as important in the digital space, and so they do not even consider disability when they are suggesting the digital options for delivery of social protection. So we must do a lot of awareness, sensitization, and capacity building to improve, to reduce the attitudinal barriers. Then lastly, if we talk about the environment, and like I said, in the environmental barrier, we look at it from both the physical environment and the digital environment. For the physical environment, there is need to implement the necessary legal and policy framework to make our environments, physical environments, more accessible. I talked about ATMs. When you have a cash transferred to you through a social protection program, you have the ATM card, but the ATM, the machine itself, is installed in a space that is not physically accessible for, say, somebody who is on a wheelchair, or for me who is a blind person, or is put in a place that is not covered from the sun for a person with albinism, then that digital infrastructure is not accessible for us then. Okay, then when we look at the digital environment itself, that is the hard and software which comprises what makes up the digital infrastructure. Oftentimes, for example, the automated teller machines are not designed for blind people to easily operate. They don't have screen readers, okay, like I have on my phone, a screen reader. So I can't go and operate the ATM independently without a third party. All right, so there's need to begin to, for internet stakeholders, digital stakeholders, to begin to look at how to ensure that the digital infrastructure we are using to support social protection is made digitally accessible in line with the W3C guidelines, which we all know. All right, so I think these are the ways to structure the solutions to the barriers that I have talked about. Thank you.
Thank you so much, Doctor, for highlighting that it's very important to have representation at all levels, from the design, development, implementation, and evaluation of digital social, generally systems, but digital specifically today, digital social protection, infrastructure, and policy. Thank you for highlighting that. Mr. Ponde, I'll come to you now. The same question, but I would like you to share if there are any policies or lack of policies, if what policies would need to be in place, if there aren't in place now, to address the challenges that you've spoken about in regards to street vendors, street workers accessing digital social protection.
Thank you very much. Maybe before I respond to your questions, allow me to mention to you, to everyone here, that we need to have tools. The tools are what is going to take us to our desired, destination or the desired results. What are these tools? As we all know, what we are doing is Agenda 2030. And Agenda 2030 defines that no one should be left poverty. There are international labor standards that have followed since the Agenda 2030 started in 2015. The very same year of 2015, there is an instrument, or rather a tool, which the ILO recommended, which is the transition from informal to formal. This is ILO recommendation number 204 of 2015. I don't know how many African countries have domesticated this tool, or rather this instrument. I don't know if we have some medias here. Every after June, when ILO convenes its International Labor Conference in Geneva, when they come back to when other government leaders go back to their leaders, I don't know if we interrogate them regarding such tool. The other one is Convention 190. This is to do with harassment. Most of our members are harassed. Some are harassed through the legislatures that are enacted in certain parliaments, like where I'm coming from, Zambia. There is an act of parliament which criminalizes, a street vendor. Whenever this vendor is found on the market, on the street, doing trade, he has committed a criminal. But that that Convention 190 protects us because we are workers. That's what ILO defines us. But if ILO is saying we are workers and this government is saying I'm not a worker, then why do they participate in agreeing to adopt such conventions? Then it doesn't make sense. And in this vein, I would love to challenge the media to be reminding our respective governments across Africa to say, what does this mean? When you were, adopting this kind of a tool, what was going through your minds, or what did the participants during the convention say? Yeah. Now coming back to the policies, definitely in enacting these policies, we would love, enactment of these policies to be associating with the same, tools, the international labor standards that I've just shared with you. Of course, even at country level, there are laws that govern the same street vendors, which we call them, local government acts. And at times, we have what we call bylaws, laws that are enacted in an individual municipality. So our appeal is that every time there is these bylaws enactments or local government enactments, they should always, marry whatever they want to do with these international labor standards. Yeah. Of course, the barriers. I think they are across the board. What our visual impaired colleagues encounter, they are the same. In fact, in our organization, we also have the same people. The people who are visually impaired, those that have physical challenge, the aged, and other marginalized or vulnerable personalities. So basically, in our view, the solution to this is that we are not just like advocating for inclusion, but we are, it's not just about inclusion, it is also about participatory. Because I can be included maybe during the debate, but if I'm not given space to speak out the way we are speaking out, then it won't make any difference. So our appeal is that every time our respective governments wants to enact, let them begin by first inviting us, give us a space to do our submissions regarding to our needs. Yeah. And the other thing is that the reason why we are saying we should be participating is that we are the actual players. Whatever laws that are going to be enacted, obviously, they will be meted on us. But if they are going to be meted on us, and we are left out in the decision making or the submission of these, so it remains cardinal for our participation to be a priority. This goes to our colleagues, those that are advocating for internet, as part of the social protection. This is a very good move, but we still need to tailor in such a way that even us, like the way this forum has been organized, we are grateful. In fact, let me mention this. We are so grateful to the organizers of this forum, this conference, because at least we are collaborating to champion, for the Agenda 2030. As long as, the digital advocates um, are distancing themselves from us because their work is to advance our agenda. It's not just about the digital players. No. Your agenda as digital players or advocates is our agenda. How are we going to collaborate? The collaboration is that um, the media is there to inform, educate. How are we going to educate or reach out to our people who have no access to information? Is by engaging the leadership for this informal economy workers, because we know where to find these people. We know what they need. We know that this person can't understand the usage of an app. This person can't understand the usage of a smartphone. So this is a welcome move. Thank you.
Thank you so much, Mr. Fonde. I think in maybe I think it's equal parts alarming and non-alarming to some of us in here to hear that in policy development that legislation is developed that is oppressive towards the people that it's supposed to benefit. It was alarming to hear that there's specific policies used to harass street vendors. But thank you for highlighting that we need to foster understanding and collaboration between workers, organizations, and digital players, and this is what this forum is for, and hopefully we will deepen that understanding when we open the plenary. Catherine, you mentioned some barriers, awareness being one of them. Access to information is a key digital right, the human rights, both offline and online, and the lack of understanding of systems. So in Zambia and for domestic workers in Zambia, how are these being addressed or how can they be addressed, especially by digital players? Because when they're accessing digital protection systems, we have the implication of the right to access, we have the implication of even data security. So now you said people call on the phone and they're asking for money and they don't know that they don't have to share certain data with people, how to verify systems and things like that. So what is in place or what can be put, if there aren't, what can be put in place to address these challenges and barriers?
Thank you so much. I think we can address the barriers by creating a curricula for domestic workers on technology. The same way we have the do's and don'ts in, let's say at the airport, they'll tell you don't carry someone's bag without someone you don't know, don't let them leave you with their bags. I think that's just a simple example. If we can use that as well in dealing with digital security, you can't give letting domestic workers know that you cannot just give out your NRC to anybody, and also telecommunication companies, because if people are calling, where are they getting numbers for people? And also some people lose money in their mobile accounts, because in Zambia we have, for people that don't have bank accounts, they also have mobile money. It's an easy way of sending and receiving money. Sometimes people wake up to no money in their account, and message pops up from nowhere and say, put your PIN. People that are knowledgeable, they put their PIN and their money is gone. If we can put up measures of awareness and inform domestic workers, people that cannot read and write, that they cannot just give out personal information to people they don't know, it will improve the system, and as well as creating a visual representation of policies and information, or rather awareness. For people that cannot read and write, when they look at a picture, it should be able to send a message, because there's power in visual. I'll give an example of the convenient room. For somebody who can't read, when they see that drawing, they'll know that this is the female side and this is the male side. I think that also will help spread information, because not everybody can say, oh, I want to read and write at 50, or I want to read and write. Even at 20, people do not have that interest. So if we can simplify our messaging and localize our messaging to basics that anybody can understand just by looking at it. I know we cannot, I'll give an example of this report that is being launched. We cannot visualize everything in here, but for storytellers, they're able to simplify this in small images that are easily understandable by everybody. Just by looking at something, they will know that this is what we're trying to bring across, and that will make it easy for everybody, and it will be inclusive at the same time. And also we need to create friendly spaces that people can go to and have conversation and learn about things that they do not know. For instance, if we have ideas in Zambia, we know that they are found at this particular place. If we have anything that we need to find out about research without paying anything, people can sit and they have a facilitator to facilitate a session. We can have ADRN talk about different things that benefit the marginalized. They can just go and sit and say, oh, today I want to hear about internet freedom. Today I want to hear about digital social protection, and there will be an expert who can simplify or initiate conversations in simpler words, simpler terms that includes everybody. And also, if there's somebody who can do sign language for people that can't speak, if we can have brailles explaining and simplifying digital apps as well, like Doc mentioned about websites that do not accommodate people with visual impairment. If we can have things translated or simplified in simple ways, that will help promote digital social protection and awareness. Thank you so much.
Thank you so much, Catherine. Yeah, for sharing those insights. I just wanted to point out before I continue that based on what you've said, the ADRN is also producing some very broken down, easily understandable graphic communication about workers' rights, digital rights, and disability rights, and these will be available soon on the ADRN website. But thank you for that very important recommendation for accessible and easily understandable communication for policy development, everything that goes on with digital social protection. And I think it buttresses the point that Dr. Adebayo and Mr. Ponde made about participatory approach to the design, the development of systems and legislation and policy for digital social protection that is not just, is beneficial to everyone, especially marginalized workers and the vulnerable. You also touched on capacity building, which I think is an important recommendation because we take for granted, we feel because we know something, the next person knows that, or if something is obtainable in one country, perhaps in Ghana, that it's the same thing in Nigeria. But for what we're seeing, what we're hearing from your experiences and what we understand from the output of the research is that this is not the case. So like you rightly said, there is a need for us to have these spaces where we come together, where it's relaxed and we can exchange information, exchange learning, exchange experiences, to make sure that all the needs are taken into consideration in the design and development of digital social protection systems. So I want to come back to Dr. Adebayo. You mentioned three layers for attitudinal, institutional, environmental, which is broken into physical and digital barriers towards workers with disabilities accessing social protection, but particular digital social protection. And we often gloss over these nuances. So I wanted you, just as Catherine has given some examples, to give some examples on what provisions, give more detailed examples on what provisions can be made to accommodate these nuances that we most often gloss over for workers with disabilities.
All right, thank you again. I think one of the big issues that came up in our study was that two or three things. First is that people with disabilities or workers with disabilities mostly live in very rural communities that are underserved in terms of internet and mobile services. And first, let me also emphasize that you see, internet means a lot for persons with disabilities. I give a quick example. I came in to Dakar on Tuesday, and unfortunately, my phone charger cable was not working. I didn't know that I had to bring in an adapter to be able to use electricity in Senegal. And so I came in around 6 p.m. All through from 6 p.m. to about 11 p.m. When I came from my hotel to this venue on Wednesday, I was cut out completely from the internet. And without internet, I am completely helpless. I can't do anything because I can't use the biro, I can't use the pen, I can't use the paper. I'm heavily dependent on internet. And so if internet is not accessible to me, I can't work effectively as a worker with disability. So from that perspective, what we found in the research is that if internet is not accessible where we live, most of us live in the rural areas, then we are completely cut out. We can't access services. So we want our colleagues in the internet advocacy or digital advocacy spaces, we want to work with you to speak loudest to make sure that internet spreads to all corners of our communities quickly as possible. Because without internet, we are more vulnerable, we are multiply vulnerable. Again, the digital tools, devices, the phones, many workers with disabilities in Nigeria were just still struggling about the minimum wage. Okay? And one thing that adds to our costs of living is what we call disability cost, the cost of being a person with disability. And so as a worker with disability, if governments are not considering those kind of additional support for workers with disabilities to have an allowance, maybe called disability allowance, to our wages, workers with disabilities will not be able to afford digital equipment, assistive digital tools, like this phone I'm using, like wheelchairs, like magnifiers, and so many other equipments, digital equipment that we need, then we will not be able to work effectively. And when we don't work effectively, we don't earn enough to survive. And so it's back to the poverty, the relationship between disability and poverty. So we're back to square zero. So it's important that governments and our advocates look at ensuring the affordability of digital tools, equipment. A lot of these are manufactured in the global north, some part of the global south like China and Cobalt. We heavily import dependent countries have to do a lot, maybe through waivers of duties or taxes, to make sure that these digital devices are available to us, because that's what our research is showing, that many people, workers with disabilities, cannot afford, with what they earn, they cannot afford digital tools. So it's not just that the internet is not spread enough, the digital tools are also not accessible, affordable. Then finally, we found that a lot of the people with disabilities or workers with disabilities are not digitally literate. Okay, they start capacity gap about digital tools, and some of the reasons why this is happening is because there's a rapid development in the digital tools. The tool you are holding this year, by in 2-3 years time, is no longer in vogue, and of course a lot of things keep changing. The websites, the softwares, everything is changing, so it renders what you have initially very useless. Okay, and so capacity is very important, awareness is very important, and so we think that digital advocates and actors should also prioritize, like Catherine said, we should prioritize vulnerable workers, especially those with disabilities, in awareness raising, in training, in literacy programs, so that we can bridge that information gap among people with disabilities. And lastly, please, issues around privacy of information. If you observe many of the things I said, you, as a person with disability, because of the inaccessibility of the digital platforms, tools, and processes, we have to depend sometimes, because we are also not very digitally literate, we have to depend on third parties, and this exposes us to risks, a lot of risks. So when you go to the ATM to withdraw money with a third party and they study your PIN, like Catherine said, you find your money disappearing from your account. So these are some of the issues around privacy. And of course, in our study, we found that administrators of digital social protection often use the information, personal data they have, to exploit some of our colleagues with disabilities, especially the females. Okay? And so because of their vulnerability, they are promised a few things, they are sexually exploited, they are financially exploited, and so on and so forth. So we need a lot of sensitization, a lot of engagement with organizations of persons with disabilities. I don't know if ADF, African Disability Forum, is here. We are talking about Fifth Africa. We want ADF to be here. We want our associations to be here at the table, so we can have more participation, and we can disseminate this knowledge among workers with disabilities. Thank you.
Thank you so much, Dr. Adebayo. I'm mindful of time because we started 15 to 20 minutes late, so I want to give an opportunity for plenary for questions and answers, because I see you're taking notes as well, so that you have that opportunity to ask the questions and make contributions as well to the discussion before our time is up. So if anyone has a contribution, something they want to share, or a question.
Just to find out from my daughter how one can get. Sorry, my name is I am Gladys Mboya from Cameroon. I'm a lawyer by profession, and I'm the president of FIDA Cameroon. So I wanted to know from her how you can get connected to that international body of in charge of domestic workers, because like you just told us some lofty things about domestic workers in Zambia. Yeah. In Zambia, in Cameroon, what I know is that domestic workers are still like people who have no rights. They don't have any rights. Most 3/4 of them are not registered with the. It's not as if it's the laws said they should not register them, but they are not registered, and it's like maybe that lack of awareness, and then nobody does anything about it. So I just started of recent trying to raise awareness about the fact that domestic workers, they have rights like any other worker. They should be put to on the minimum, because they just employ them and give whatever pittance they want to give. Nobody cares. There is a barem for salaries. You are not supposed to go below that. But I can assure you that the requirement of domestic workers, they don't even attend that. People just negotiate privately with them, and they are modern slaves, honestly. So I think it will be a good thing to connect more with you and see how I can help within my own country. Thank you.
Thank you so much for that. I remember, I think July, we had a digital social protection and care work conference in Rwanda, and we had somebody from Cameroon, but I'm not sure how strong the union is that side, and I'm not sure of their name. I don't think they carry the same name as we do, but if you you have a smartphone, you can just search for IDWF on your Google or Facebook. We're very active on Facebook, actually. Yes, if you send a message now, somebody will respond. And we can have a chat afterwards. I'll give you an email that you can write to. Thank you so much.
Je vais parler en français. Bonjour à tout le monde. Oui, c'est bon. Good morning. Excuse me, good morning. Speaking very well French, more is English. Okay, thank you. Okay, yes. Okay, c'est bon. Okay. Bonjour à tout le monde. Merci vraiment pour cette panel très inspirant et merci aussi pour le thème que vous avez évoqué, le droit des numériques des travailleurs sociaux. Et ça nous interpelle nous tous en tant que des acteurs communautaires. Mon nom c'est Aboubakri Diallo, je suis sénégalais et je travaille dans la municipalité de Dakar en tant que responsable du système informatique. Mais en même temps, je suis un entrepreneur social qui est chargé de sensibiliser les communautés sur les bonnes pratiques du numérique. J'ai beaucoup fait des activités concernant la protection du numérique, l'entrepreneuriat numérique. Aujourd'hui, je pense que le thème que vous avez abordé concernant l'accès au numérique aux personnes handicapées vient en son heure. Et je pense que les méthodes qu'on devait prendre au niveau des politiques publiques de nos gouvernants, c'est qu'aujourd'hui qu'on puisse traduire les données numériques en langue locale, surtout en Wolof par exemple au Sénégal. Parce que je vois même les domestiques qui sont les gouvernants dans les maisons, on est en train de les alphabétiser en langue française. Je pense que dans cette même procédure, si on arrive à les sensibiliser dans cette langue locale, ils pourront vraiment être mieux sensibilisés. Et à l'issue du discours du panéliste, que je remercie de passage pour son intervention, je pense qu'aujourd'hui, il faut mettre en place une politique de confidentialité des données. Il faut aussi faire une formation et sensibilisation, mais surtout aussi essayer de voir comment accéder aux données, mais surtout la protection des surveillances exclusives au niveau des alertes malvoyants, mais surtout aussi faire recours à la violence. Parce qu'il y a beaucoup des groupements de femmes, de jeunes, qui sont menacés au niveau des réseaux sociaux, mais ils ne savent pas attaquer, parce qu'ils ne connaissent pas les bonnes pratiques. Aujourd'hui, je pense qu'on doit les former. À chaque fois qu'il y a ces gens de menaces que vous avez évoquées tout à l'heure, qu'on puisse aller faire recourir au niveau de la cybercriminalité, au niveau des données personnelles. Je pense que cette activité qu'on vient de faire avec ce forum, je pense que ça mérite d'être élargi au niveau de la base locale pour que les populations cibles, les couches les plus vulnérables, parce que ce sont les bénéficiaires, ce sont les parties prenantes. Aujourd'hui, quand on parle de la liberté de l'Internet en Afrique, je pense qu'aujourd'hui, la population, les femmes, les jeunes, sont aujourd'hui tellement, doivent être profités de cela. Parce que nous tous nous voyons aujourd'hui, les jeunes sont tellement accrus au niveau des médias sociaux avec le smartphone. Et ils ne savent même pas comment poster une information. Ils ne savent même pas que ces données ne sont pas tellement, ils n'appartiennent pas à eux. Ils sont logés dans des serveurs inconnus. Donc cet atelier vraiment vient à son heure et j'espère qu'à l'issue de cet forum, les recommandations seront bénéfiques à tout un chacun. En tout cas, merci et je m'excuse. Je voulais vraiment m'exprimer en anglais, mais je pense que c'était en français que cette communication pourrait être bien portante à vous tous. En tout cas, merci.
Yes, thank you so much. Sorry, your name again? Abubakar Jallo. Yeah. Thank you so much for that submission. So he was speaking about the need for policies and systems to be equitable and paying attention to a submission from Dr. Adebayo about even the deepened layers of vulnerability. So even, for example, he talked about disabilities, but then there are women with disabilities who also are vulnerable to sexual harassment and come across other challenges. So developing policies and systems that are equitable for everyone, that take into consideration the needs of everyone. He also touched on data security, data confidentiality, the concern of surveillance when your data is shared using this system, especially for those with disabilities, and the need for education, digital literacy. So in summary, that was the submission. Thank you.
Um, Thank you very much. My name is Elizabeth Atori. I am from an organization in Uganda called the Initiative for Social and Economic Rights. And I'd like to, first of all, applaud all the panelists on a lot of what they were saying resonates with us, especially the question around exclusion of marginalized workers. I just wanted to share around the experience of Uganda. For example, in terms of pension, the pension sector will cover those that are gainfully employed in the formal sector. But like the experiences that were shared, the workers in the informal sector are left out. And the only possibility for them to start to gain social protection benefits is when they turn 80 years and above in Uganda. That's when they can be able to join the government program that gives about 25,000 Ugandan shillings. I don't know how to convert that. I would have to do the mathematics, not a mathematician. But yeah, they would have to get to about 80 years and above in order to start to gain benefits from the government. That means a bulk of the informal workers are being left out before they turn 80 years. And yet we know that the life expectancy is much lower than that. We are at about 65 right now. So that means many people are left at the fringes of the social protection system. But a true thing that was also stated was around the vulnerability of persons with disability. And if we are looking at the population in Uganda and those particular people that we should be looking at, and for example, if we're talking about people who are 65 years and older, oftentimes they are actually heading households. They have grandchildren to tend to in remote areas of the country, and they have a whole family to support, and yet they are not able to get the support that they need. And this is because, as a country, we have failed to put in place legal frameworks that can support informal workers. For a long time, even with NSSF, you needed to have 14 employees and above in order to register your company to remit the national social security benefits. It's just recently that as a country we opened up the national social security benefits and said, okay, even when you don't have more than 14 employees, you can still remit as an employer. But those are legal reforms that we need to be able to adapt. So while we focus on access, we also need to think about the legal ecosystem within the countries that we are in. And we need to start to push for more reform in terms of legal protections for workers that are marginalized. If we're even talking about persons with disability, yes, there are those that are within the workforce, but you'll find that majority of people are even unable to find work or gainful employment. So what are the social protection systems that we can put in place for those categories of individuals that are vulnerable in themselves? I think those are questions that we need to ask ourselves and that we need to rally around to push further. I believe the voices in the room around some of these questions are not loud enough, or we haven't yet reached that momentum where we are actually able to cause as much change as we need to cause. Oftentimes, for example, when we are pushing for inclusion, you'll find that it's just a few organizations that will be in the room and that will be calling to account the government. But we need to be able to strengthen civil society organizations to push for some of these demands, to push some of these recommendations. And I think that's something that we can take back home with us.
Thank you. I think that you have said two things that I quickly captured. The issues around the legal ecosystem. I can tell you that there is an African Disability Protocol to the African Charter on Human and People's Rights. As of today, only about 15 countries in Africa have ratified it. We need to push. That's why I asked about African Disability Forum, if they are here or if they're in this conference at all. So we need to engage across the continent so that we can have a louder voice. There's a network for domestic workers here. There's a network for street workers here. So we have the networks. So I think it's about collaboration across regional or international networks so that we can amplify our voices. Sometimes, in most cases, the legal frameworks, the policy frameworks are there. It's just implementation that is the major problem. Many African countries have domesticated the UN Convention on Rights of People with Disabilities. Many African countries, about 40 of them or more, have also enacted the Disability Acts, including Nigeria, and I know Uganda has. We have all these legal works in place, but it needs to be implemented. That is what we see. And of course, the governance of these policies, you don't often see persons with disabilities or workers with disabilities in the spaces. That's what our research showed. In the labor unions in Nigeria, for example, we found that workers with disabilities are not, they are not properly represented in the mainstream labor unions. And so we can't have that voice as workers with disabilities to push for our concerns, all right? And like we have with domestic workers and street traders and all of that. Then the other part is what can be done in terms of the kind of social protection we need for those who are not working among workers or who are in the informal sector for workers with disabilities. Yes, we expect that governments will have will modify the pension schemes to accommodate informal workers. I think that conversation is on. We have it in Nigeria, but the conversation for us at UNAPID in Nigeria is to ensure that workers with disabilities in the informal sector, they have the template to get on that scheme. And of course, persons with disabilities often rely largely on the social assistance aspect, not the contributory schemes. So, because what they are earning is very little, and so if they don't have the earnings to contribute, then there should be a social assistance program that helps to augment their earnings. I think this is also a key issue for that disability organizations like UNAPID, like African Disability Forum, and our other federations of organizations of people with disabilities in Uganda, in Zambia, in Zimbabwe, and other countries need to also, focus on. Thank you.
Thank you so much, Dr. Adebayo. May I take those as your closing remarks? Yes. All right. We have run out of time, but I'll give our other panelists, Mr. Ponde and Catherine Seteka, the opportunity for final closing remarks, just a sentence or two with your call to action to those in the room today.
I'll be very brief. In fact, I will just use 4 words. Digital people that have brought us together here. Our word is the street vendors across Africa is ready to work with you. But can we don't just include us in your duty, but let us participate, then we are going to have an effective outcome. Thank you.
Thank you very much, Mr. Ponde. And Catherine?
Thank you so much. I would like us all to spread the news. I hope we've gotten 1 or 2 things from the conversation that we've had today. And let's be the advocates out there. And also, I would like everybody to know that integrating digital solutions to social protection can improve the livelihoods of domestic workers. So let's keep them in mind, keep us in mind, and let's spread the word. Thank you so much.
Thank you to our panelists, Mr. Ponde, Ms. Nseteka and Dr. Adebayo. Thank you for your insights and for emphasizing the need to bridge the digital divide through access to information, availability of infrastructure, capacity building of digital skills, and the need for implementation of current policies and promoting a participatory policy development environment. I want to thank the organizers, especially CIPESA and ADRN, for this platform to have this important discussion. Like the panelists have said and shared, we encourage and we welcome you to continue these conversations and to work together to develop equitable and inclusive digital social protection systems that benefit everyone. My call to action will be to the digital rights advocates and digital rights organizations in the room to create these spaces, as we've listened to today, collaborative safe spaces where we can all come together and listen, platform diverse voices so that we can promote participation and increase mind share of these issues and that we can get to a tipping point for change. So thank you for your time today and enjoy the rest of the conference.